Spotting refers to that light bleeding that can occur during pregnancy. For the purpose of this video, we are going to concentrate on the early stages of your pregnancy. Is it common to experience spotting during your early stages of your pregnancy? Let me help you address this question. You are welcome to Everything Moms. Here you are going to get actionable tips to support you in your parenting journey. This video is brought to you by Palm Starch Palo. More about them later in the video. Let's get straight into it. At the end of this video, you are going to know the causes of spotting, which ones are normal and which ones are abnormal. You are also going to know the preventive measures to undertake. You are also going to know when it is necessary to contact your healthcare provider. The first things first, what are the causes of spotting in pregnancy? Let's take a look at the normal ones first. Implantation bleeding is one of the normal causes of bleeding or spotting during the early stages of pregnancy. When the fertilized egg implants itself in the lining of the uterus, it can cause bleeding. And this is normal. Most women, about 20 to 30% of pregnant women are going to experience this. Cervical change is one of the normal causes of bleeding during your early stage of pregnancy. You know, there's going to be an increased blood flow to the place now that you are pregnant. And it is normal to see light bleeding from the cervix during this time. Now that we are done with knowing the normal causes of spotting in pregnancy, let's take a look at some of the abnormal ones. Miscarriage. Spotting can be one of the earlier signs of miscarriage, especially if it is accompanied by severe cramping and abdominal pains. Ectopic pregnancy is one of the abnormal causes of spotting in early stages of pregnancy. You know, in some cases, the fertilized egg does not implant in the uterus, but it implants outside the uterus, which is usually in the fallopian tube. If this happens, it is going to cause spotting or bleeding. The next one is infection or irritation. If you get infected in the cervix during your early stage of pregnancy, it is usually going to cause spotting or bleeding. Now, having said all the abnormal causes of spotting in early stages of pregnancy, when should you see your doctor for help if you see spotting in your early stages of pregnancy? Rush to the hospital if bleeding is consistent, heavy, and it is accompanied by severe abdominal pains and cramps. What are the preventive measures? Are there some things that you can do to prevent spotting in early stages of pregnancy, especially the abnormal ones? Yes. 1. You have to rest. If you can, have enough rest as possible. 2. Avoid heavy lifting. And if it is necessary that you have to lift something from the floor, you have to go all down and pick the thing up and come up with it. The third preventive measure to take is not to skip your prenatal appointment. You always have to go for your prenatal appointment. In case of spotting, your midwife or your healthcare provider will be in a better position to assist you before it turns into complications. Stay hydrated and eat a well-balanced diet. Palm Starch Palo is the sponsor for today's video. You see how radiant I'm looking? She made me up. And one thing I like about her is that she will listen to you and advise you on what to go in for. Even if you want to learn makeup for your own self, she's available to do that for you. And her number is left on the screen for you to contact her at any time. I hope you have learned something new. If this video has been helpful enough, don't forget to give us a thumbs up, subscribe to the YouTube channel, and hit the notification bell to get notified each time we upload a video. See you in the next video. Bye!